Hi, my name is Maria and I'm going to be your NP student for today. We're going to go ahead and do a head to toe assessment, but first I want to go ahead and get your consent.
Yes.
Alright, I'm going to start by washing my hands, and then I want to go ahead and show my badge. And you can see a picture with my name on it. And then we're going to go ahead and show my table to show you that I'm not cheating with anything. This piece of paper is for the end of the exam. I do have some vitals down already. And then I have a longer sided blank. So nothing else is, there's no cheating. And then we're gonna go ahead and do a 360 of the room. We're gonna start off, his blood pressure was 146/88. That was a little bit high. Right now his pulse is 57. Pulse ox is 97. We're at 97.8 for temp. I think I did say pulse ox is 97. So looking at him, he, well, his age is 29. He is male. He is well nourished. He has clean clothes. He is appropriately dressed. He does not look sweaty or dry skin. Looks hydrated. He doesn't. I'm gonna go ahead and just palpate his forehead and feel that he is warm, appropriately warm. He's pink. He's not sweaty. And then I'm going to go ahead and look at his head. His head, he has appropriate amount of hair. There is a slight receding hairline, but hair otherwise looks good. We're going to go ahead and his head looks symmetrical, norm cephalic. We're going to go ahead and feel for any lumps. And I'm going to see that there's no lumps, bumps, lesions, depressions of the head. And I am going to go ahead and move on to his face. His face looks symmetrical. I'm going to have you put your feet down for me. His face looks symmetrical. Eyes, ears, nose, eyebrows. And I'm going to start with his ear. I'm going to start with his eyes. Starting with his eyes, I do not see any foreign objects. His sclera looks white, not yellow. I am looking at his eyebrows. His eyebrows look symmetrical. I'm going to pull down on his lower lids. His pink conjunctiva, no drooping eyelids. And then I'm just going to go ahead and check for a reflex of his eyes, but also a red reflex. So I have my otoscope 0.0. And I see the red reflex right off the bat. Do another eye. So both eyes bilaterally have a red reflex, but they also have the pupillary, pupils are both responsive. Next I'm going to move on to his ears. His ears look symmetrical. They look pink and vascular. I'm not seeing any apparent drainage on the outside. I'm going to go ahead and take a look on the inside. So I am not seeing any redness, swelling, or bleeding, so no signs of infection. Did it hurt when I pulled on your ears?
No.
So no tenderness, so no signs of infection. And his tympanic membrane both bilaterally look pearly gray. Next, looking at his nose, I'm going to have you plug one side and breathe in, looking for patency, and switch. Then I'm looking at his nose. His nose looks symmetrical. I'm not seeing any drainage, any bleeding. I'm going to take a look. I'm not seeing any bleeding, any swelling, any redness. There's no septum deviation. I'm gonna next look at his lips. His lips look pink. They look symmetrical. There's no cracks, sores, or lesions. And then I'm gonna have you go ahead and open your mouth. Dentation is intact. No missing teeth. Pink membranes. Go ahead and stick your tongue out. Go, wider. Uvilized midline, soft and hard palate are intact, and like I said, mucosal membranes are intact. Are pink and moist. Next, I'm gonna go ahead and palpate his sinuses. We're gonna first start with his frontal, ethmoid, sphenoid, and then maxillary. Any pain with that?
No.
And then we're gonna go ahead and feel for his TMJ's temporal mandibular joint. Go ahead and open, close. No cracking, popping, or crepitus present. We're gonna go on with his lymph nodes and palpate his lymph nodes. Occipital, preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical, postcervical, supraventricular, intraventricular, and I am feeling no swelling of the lymph nodes, no nodules, bumps, or anything like that. I'm seeing that his neck is midline. And next I'm going to move on to the cranial nerves. I'm just going to grab my scent over here real quick. We're going to test cranial nerve number 1. So I'm going to have you go ahead and take a smell of this. What do you smell?
Vanilla.
That is correct. So cranial nerve number 1 is intact. For cranial nerve number 2, it's going to be his eyes. I already completed the Snellen test just because with the room constraints, I didn't have enough distance to film for that. So he already had, he has 20/40 vision from the Snellen test bilaterally. Going on to cranial nerve, so cranial nerve number 2 is intact. Cranial nerve 3, 4, and 6 is going to involve his eyes. So I'm going to first look at his eyes. Again, they are symmetrical. I'm going to go ahead and place my hand right here. And I'm going to go ahead and take the light to one eye. His eye does respond. Then I'm going to go ahead and do the other eye. And so his eyes are, they're so far accommodating and consensual. And then we're going to go ahead, well, I haven't tested all that just yet, so we're going to take my finger and you're going to follow it. And we're going to go follow my finger in. So his eyes are equal, round, reactive, consensual, and accommodating. Moving on to cranial nerve number 5. We're going to look at his face. So I'm just going to have him, again, open his jaw and close. Open and close. And his cranial nerve number 5 is intact. He's able to open his mouth and close. Cranial nerve number 7, because I already did 6 with the eyes. Cranial nerve number 7, I'm going to have you raise your eyebrows up and down. Smile. And don't smile. So eyebrows are symmetrical, smile is symmetrical. And then we're going to go ahead and move on to cranial nerve number 8, which are his ears. We're going to start with the Weber test. I'm going to place this on your forehead and you let me know if you hear it in both ears.
Yes.
We're going to go ahead and do the Rin test. I'm going to go ahead and click this, put it behind your ears. When you no longer feel it or hear it vibrating, move it to the front of your ears and you just tell me when you don't hear it anymore.
Gotcha. Don't hear it anymore. Don't hear it anymore.
Good.
Don't hear it anymore.
So hearing is intact. And then we're going to do the last hearing test, which is the whisper test. I'm going to have you close one ear, close your eyes. I'm going to whisper a word and you just tell me what you hear.
Apple.
Go ahead, we're going to do the next one.
Dog.
His hearing is intact. And we're going to go ahead and move on to cranial nerve number 9, which I'm going to go ahead and give you this water. I'm going to have you swallow for me this water, but don't swallow until I ask you to. Okay, so just take a little sip and go behind the table. All right, go ahead and swallow. Swallowing reflex is intact, and then I'm also just, can you take one more sip for me? Go ahead and swallow. And thyroid, there's no enlargement of the thyroid, no lumps or bumps as well. One more swallow. Yeah, I'm not feeling any enlargement of the thyroid. All right, so that was cranial nerve number 9, which is intact. Cranial nerve number 10 is going to be checking for the gag reflex. The wrong one. All right, go ahead and open wide. Say eh. Gag reflex is intact. For cranial nerve number 11, I want you to shrug your shoulders up and down, turn your head side to side. Good. Now when you shrug up, I'm going to just pull you down, okay? So shrug up. Good. And then as you turn side to side, I'm going to put pressure against it, okay? So turn this way. Good. Turn the other way. Good. Cranial nerve number 11 is intact. For the last one, it's cranial nerve number 12. For tongue, once you stick out your tongue, straight out. Tongue is not deviated, go side to side. Cranial nerve number 12 is intact. Next, I'm going to go ahead and feel for the carotids. Carotids are 2+. And then I'm going to go ahead and listen for a Birri. All right, go take a deep breath and hold and release. And then deep breath and release. Sorry, take one more deep breath and hold and release. No Birris present bilaterally to the carotid arteries. Next, I am going to move on to his cardiac exam. I'm going to first point out the angle of Louis. I'm going to ask you to go ahead and take off your shirt. Okay, the angle of Louis, right about there. I'm just going to have you take a deep breath and hold. Feeling no thrills. Go ahead and breathe. All right, then we're going to go to the left mid-clavicular line down to the 5th intercostal space, and then that will be the maximal impulse point, and we're just going to go ahead and just feel right there. For any Birris, and I don't feel any. And then we're going to go ahead and listen to your heart sounds. You just breathe normal. Apical. parietal. I mean, not parietal, percuspid. Tricuspid. They're at the mitral. S1 and S2 are present. It's regular rhythm. And then I'm going to listen for some Birri. So again, we're at the apical. Parietal. Tricuspid. And then mitral. I'm not hearing any Birris either. Next, I'm going to have you go ahead and lay down. I have him at a 30-degree angle, and I'm just looking for any jugular vein distension. And I do not see that present. And then I'm going to go ahead and examine his abdomen. I see that his abdomen, there is no discoloration, no scarring. I see that there is no distension. The color is good. I'm going to go ahead and just listen for his bowel sounds. Bowel sounds are present, and I just want to go ahead and go backtrack to my heart sounds, and that was the pulmonic heart sound, not the whatever I said. So artery, pulmonic, tricuspid, mitral. Next, I'm going to go ahead and listen for Birris. I'm starting at the aortic. The renal. We move on to the iliac. And the femoral. I'm not hearing any Birris. Then we're going to go ahead and percuss. And I'm hearing tympanic noises, which is to be expected because there's gas and there's not any occlusion. I'm going to go ahead and percuss the liver. And the liver measures about 8 centimeters. Then percuss the spleen. And they're both tympanic noises, which is what we want to hear. Any pain with that?
No.
Good. Then we're going to move on to, we're going to palpate the stomach, do leg palpation. Any tenderness with that?
No.
If there's any tenderness in the right lower quadrant, it'd be a sign of appendicitis. Then we're going to deep palpation. And I'm not feeling any masses. I can palpate the liver, but I cannot palpate the spleen, which is normal. All right. Next, I'm going to go ahead and do the ballotment test for the kidneys. Take a deep breath and out and hold. All right. And breathe normal. Not really feeling much of the kidneys. Not feeling any masses. Deep breath. And out. Yeah, I'm not feeling any nodules, so no nodules, no masses present. Go ahead and sit back up. And if you can just stay right there for, if you could turn around and face the camera back to the camera. Awesome, thank you. Next, I'm just going to percuss the kidneys. And that's more of a tympanic sound as well. Is that any pain?
No.
Okay. Next, I will be looking at his chest. I'm sorry, I'm going to have you turn around one more time. Looking at his thoracic, I see it's symmetrical. He's not working to breathe. He has an easy breath. And we're going to go ahead and just listen to his breath sounds. Deep breath. Wait, sorry. Deep breath. 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 And deep breath. All right. Anterior and posterior breath sounds are present and they're clear. I'm going to go ahead and move on to the egonophy part of the respiratory assessment. So I just want you to say E when I ask you to. Go ahead and say it.
E.
Again.
E.
Again.
E.
Again.
E.
Good. Go ahead again.
E.
Good.
E.
Good.
E.
Good.
E.
So egonophy, I'm not hearing any clouding or like where I can't hear the sound of E. Then we're gonna go with tactile for modest. Lay my hands on his back. Go ahead and say 99.
99.
Again.
99.
Again.
99.
Good. I'm gonna go ahead and have you turn your back towards the camera. We're gonna look at his spine. And by the way, to note his posture, he has good posture. Go ahead and just bend just a little bit for me. I'm looking at his spine. Now noting this, we have the C7 and T1 vertebrae. And then we're noting that his spine is straight and intact. And then we're going to note the spinal, paraspinal muscles, the trapezius, the latissimus. I'm just feeling. Then I'm looking at the thoracic and then the lumbar. Any pain with that?
No.
Good. Go ahead and turn around for me. I did not percuss my lung sounds. I do notice a scar on his left shoulder, and that is from a surgery he had from shoulder surgery. And those are resonant sounds. Next, I'm going to go ahead and have you stand up. And we're going to do range of motion. I'm going to have you bend, flex your head forward and back and side to side. Good. And we're going to do the spinal reflex range of motion, flex forward, extend backwards. And then we're going to lateral side to side. Good. Go ahead and sit down. You can go ahead and put your all right, I'm noticing his extremities. His extremities are pink, vascular, good peripheral vascular. I'm gonna go ahead and just feel, and they're warm, pink in color. And then I'm gonna go ahead and just do cap refill. Brisk cap refill, we're gonna feel for pulses. Carotid was already 2+, radial's 2+. Brachial's 2+. Popliteal's 2+. Bilateral popliteal are 2+. Pedals are 2+. And then dorsal pedis is 2+. I don't see any edema, any scratches, any bruising, any, so edema would be +0. I do see a little bruise right here. Then we're gonna do a strength test. Squeeze my fingers, bring me forward, pull me back, good. Push against my leg, push back, push forward, push back, push up and down, and up and down, good. And then we're gonna do the big toe assessment. Close your eyes and tell me which direction, his strengths are +5. And which direction I'm moving your toe in?
Up, down, up, down.
Big toe is there. Part of sensory. This is also part of one of the cranial nerve for number 5. Tell me if which side of the face you feel this on.
My left, my right, forehead.
Okay, good. Now tell me if you feel sharp or soft.
Sharp, soft, sharp, sharp, soft, 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 sharp, 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 soft, 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 sharp, soft.
So sensory is in place, and then I'm going to go ahead and test his plantar reflex.
Sharp.
And his toes did move. Toes did move. And then we're going to go ahead and do the vibration test. Let me know if you can feel this.
Yes. Yes.
Good, thank you. And then we're going to go ahead and move on to range of motion. I'm going to move your arms for you, and then I'm going to have you move it after me. We have all passive range of emotion in fingers, thumbs, wrists, elbows, arms. All right, so now I want you to abduct both arms and in, and then go ahead and bring your flex, extend, take your hands, extend them, make a fist, hyperextend your wrist, flex, extend. Okay, good. And then for a knee, let me move your knee for you. Move your foot for you. Go ahead and move your feet. Good, and then move your knees in and out. Okay, good. We're gonna go ahead and do his deep tendon reflexes. We're going to do the brachial radialis. And the brachial. And then the brachial radialis, the hand should extend. And then with the brachial, it should just extend the forearm. Then we're gonna go, we should extend the arm for the tendon. Relax your arm. Good. And this should extend the arm as well. Teller, and that was the bicep and tricep tendons that we both that I examined. And then we're gonna do the patellar, reflex present, and then we're gonna do the Achilles. So I'm gonna reflex up. And then I'm gonna have you lay down. We're gonna do the your hip flexing. Let me move your leg up for you. And then go ahead and move your legs up for me. So all this range of motion is intact. You can go ahead and sit back up for me and stand. We are going to go ahead and test your lumbar, do a lumbar test. Go ahead and close your eyes and keep your feet together. Swaying is positive, so it's a positive lumbar test. And hold your hands out. We're going to go do the pronator drift. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good, and go ahead and sit down. Last, we're going to do a cognitive test. I'm going to say 3 words to you, and I want you to repeat them back to me. Apple, ball, fork.
Apple, ball, fork.
Okay, remember those 3 words. Can you state your age?
29.
Your date of birth?
July 10th, 1992.
Your phone number?
513-746-9412.
What is the year?
It is 2021.
And who's the president?
Joe Biden.
Good. And then can you count back by 7 from 100?
Yes, ma'am. 93, 86, 79, 72.
Good. And then I want you to draw a clock for me. Doesn't have to be perfect. Can you repeat those 3 words I gave to you?
Apple, ball, fork.
And here's my clock, or his clock, sorry. And then my health recommendations is going to be history, diabetes runs on both sides of his family. So he would need to get a checkup every year. He already gets fasting blood sugars, but an A1C would be appropriate. And then his blood sugar is a little high, so I would recommend monitoring his sodium intake. And he gets takeout 3 times a week. So I would also recommend cutting back on the fast food, deep fried food, and incorporating more fruits and vegetables. And then I'm gonna go ahead and thank the patient, and I'm gonna go ahead and use hand sanitizer, and that will be the end of my assessment. Thank you.